Um, Good afternoon, or good evening, or good morning, depending on the time wherever you're watching us. This will be a continuation of my series on the prostate gland. This is probably the last series that I've been doing on the prostate gland. Today we'll be talking of what we call benign prostatic hyperplasia or benign prostatic enlargement. Simply put, is a form of enlargement of the prostate, which in most cases is age-related. It's rarely found in young people. It's usually in men who are 50 and above. And the cause of BPH is unknown, but it is believed that it has to do with hormonal changes as one grows older, and it has to do with cellular changes in response to testosterone production from the testicles. Because from findings, it was discovered that people without, testicles, people who have had their testicles removed, maybe as a result of cancerous changes or as a form of family planning, eventually don't develop BPH. Again, BPH is thought to be related to sexual activities. It was discovered that it was more pronounced in people who are people who have very low libido, people who rarely engage in sex, especially those who have committed themselves by faith to God and all that. So nobody knows precisely the cause of BPH specifically, but we do know that it may be related to some of the things that I mentioned above. BPH is not a precursor to cancer of the prostate. They are not related, though sometimes advanced cases of BPH can begin to transform, can begin to manifest some signs of cancerous changes, but they are two distinct entities. Benign prostatic hyperplasia, as the name implies, is benign. It's non-invasive, it's not cancerous tumor of the prostate, just like you have a benign tumor of the uterus, which is called fibroid. So also we have benign prostatic hyperplasia, which is non-invasive, which is not cancerous, So the symptoms of BPH is closely related to the also symptoms of prostatitis, as we mentioned earlier on. First of all, there are obstructive changes. BPH can precipitate prostatitis, infection of the prostate. Prostatitis, chronic prostatitis can also promote or enhance the development of BPH. So we really can't say which comes first. We do know that those who have BPH would definitely have urinary symptoms, and then which can potentiate infection. How, you will ask? BPH, as the prostate enlarges, it constricts the flow of urine via the membranous urethra. So the urine flow is dampened, so the urinary stream becomes poor, and it can progressively deteriorate until the point where one may have complete cessation of urine, or which we call urinary retention, complete urinary retention, which is inability to pee at all. And the bladder keeps filling up, back filling up, causing affectation of the other organs surrounding or attached to the bladder, especially the ureters, which become dilated and painful, and then ultimately the kidneys too can also be damaged with water within the calyces. So progressive enlargement of the prostate brings about progressive deterioration in your ability to urinate and to maintain a good stream of urine, ability to hold on to urine for a specific number of hours, which we call frequency, and the patient begins to visit the loo more frequent than expected. And when you get to the loo, the volume of urine being passed is poor, and the force of stream is also poor, so much that you can also have dribbling in the course of that, and one can also develop leakages, in which case, after you have worn your panties and you're going back to your bed, urine begin to dribble and begin to leak into the underwear, so much so that these droplets of urine, by the time they ferment, they begin to use pungent smell of ammonia, which is characteristic of stale urine. So it will be like when you enter that kind of room, it'll be like this patient is peeing on himself, whereas it is because urine kept on dribbling into the panties after urination. And sometimes the man gets tired before he gets to the loo. Urine will leak into the underwear, which invariably will start smelling after it has become fermented. So, how do we deal with BPH? There are various ways of dealing with BPH, but essentially I will counsel you to see your doctor and let him choose the best form of treatment for you. But I will advise you to drink water, and when you are having signs and symptoms, go to your doctor. And then sometimes if we know it's infection, antibiotic can be recommended to you by the doctor. There are so many, but ultimately the solution is one form of surgery or the other. It can be minimally invasive surgery, it can be open surgery, it can be pyourethral surgery. So many forms of surgery modalities are available for the treatment of benign prostatic enlargement. If I don't want this series to be too voluminous, I will have to stop here, which means I still have one more series to talk about the cancerous changes in prostate organ. Once again, I am yours, Dr. Joshua Ajilufo Paul, and thank you for watching, and God bless. Happy Easter celebration.